again, DFSP, right? Look at the fat entrapment there. Now this one doesn't have epidermal hyperplasia, but it's got really good entrapment of fat, honeycomb pattern. But there's a fancy special finding in this one. Pigment. And these are kind of pigmented spindle cells, and this is melanin pigment. If we did a stain, this would be positive for Fontana-Masson, negative for iron stain. So when we see these pigmented dendritic melanin-producing cells, I believe they're just spindled melanocytes. I don't exactly understand how they get into the tumor. I'm sure that there's some literature on that I'm just not as familiar with. But they are these spindled melanin-producing cells scattered in the midst of an otherwise normal DFSP. So what's the eponym that we apply to this tumor?
Bednar.
Yeah, this is a Bednar tumor. So when I see this, I just say DFSP with focal melanin pigment, open parentheses, Bednar tumor. So basically, I will still use that term because people recognize it, but I always still top line it as Dermatofibrosarcoma protuberans because that's all it is. To my knowledge, there's no special difference in the behavior or treatment of these. This is just a microscopic curiosity that's important for us to know about so we don't get confused. One potential miss would be that there is a form of diffuse of neurofibroma, particularly big kind of diffuse neurofibromas that also make melanin pigment, and they can have areas that look quite similar to this. Neurofibroma and DFSP can have areas that look very similar microscopically, and neurofibromas, just like DFSP, express CD34 pretty diffusely. So if you're having a doubt, do an S100 or a SOX10, which is extremely rare to have, is almost always negative in DFSP. I have seen one exception that had patchy S100, but in any case, just know that that would be one potential pitfall.